In over 32 years of practicing medicine on the prairie, I have seen a lot of changes in healthcare, some not so good and some good. Not so good begins with the electronic medical record, or the EMR, which has such potential, yet has so far been a disappointment. The EMR seems developed mostly to satisfy billers and defense lawyers, and at this point provides too little help with the actual caring for the patient. The myriad versions out there do not interact well with each other, and because of user not so friendly EMRs, it's just about takes twice the time to see a patient now. Hope springs eternal, however, and a much faster, easier to use, and more communicative version should be evolving in a couple years. With all the modern advancements in technology, I believe there has been reduced emphasis by clinicians on taking time listening to the patient's story, laying on of the hands, listening with the stethoscope, and actually examining the patient. I know our med schools are trying to fix that, and I personally think just maybe we do that better out here in rural places. Also not so good, I've watched how obesity, weakness, and diabetes is on the rise, possibly due to appliances, vehicles, labor-saving devices that have been making life too easy. And to boot, I believe we in the medical profession have too readily moved to emphasize a pharmaceutical treatment while not encouraging our patients to exercise enough. Some are critical of the move to physician assistants and nurse practitioners, but I believe that individually, any one of them may be a superb and intuitive healer. After all, when any clinician is greater than 5 years away from medical school or training, one is only as good as how much she or he reads, questions, thinks, and most important, collaborates. Changes that have been good include all the same technology I discussed earlier, the tremendous improvements in diagnostics with CT and MRI scans, rapid laboratory testings, and revealing genetic analysis, or in advancing pharmaceutical therapy for cancer, depression, esophagitis, hepatitis C, and hypertension, or in surgical therapy with vascular stents, endoscopies, and robotics. The list goes on, but we are light years ahead of where we were 32 years ago. And these advances are almost as readily available to us in rural America as in the big city. The biggest challenge in the years to come will have to do with financing all of this. And I predict will result in even more changes. Let's hope they are good.